What's up, future respiratory therapist? So I got an email about a question. I don't know if it was a practice TMC or if it was just a test question, but it was about a VQ ratio. And I'm going to give you an example of the question at the end of this video. So hang tight with me. But to answer this question, I'm going to break it down to another level. And I've done a video over this in the past. I don't know if it was really all-inclusive. I'm going to try to make this one a little more all-inclusive so you get a better picture, okay? So the title of this video is Shunt versus Deadspace. And ultimately, how does that affect your VQ ratio? Because that's really what we're talking about here, okay? You have to understand that as a respiratory therapist, every patient you take care of has some sort of VQ mismatch. Something is not right in their pulmonary anatomy and their pulmonary circulation. Otherwise, they're healthy individuals like us, right? And they're walking around, there's no problem. But that's not the patients we're taking care of. The patients we're taking care of usually need our assistance because we are addressing patients with shunts or dead space problems. And that affects your VQ ratio. So I'm going to try to give you some practical information here to address and to recognize shunt versus dead space. But also, how are you going to answer your VQ ratio questions on your finals, on your test, and on your TMC exams? Okay, so here we go. I'm going to draw a line right here. And we're going to break it down like this. Okay, so shunt versus dead space. Now, most students I ask and I say, what is a shunt? Most of the time they can answer that question. And what that answer is well, a shunt is when perfusion is greater than ventilation. And that's correct. And then I take it a step further and say, okay, give me an example of a disease process. Or give me an anatomical alteration that would cause a shunt. And the answer I get, if I get one, is atelectasis. Now with atelectasis, we realize that we have alveoli that are collapsed. And when they collapse, they are no longer being ventilated. But there is still blood flow passing through these collapsed alveoli, which puts perfusion in excess of ventilation. The other thing I get is consolidation. So consolidation is another good example. You have alveoli that are filled with consolidated fluid and mucus. There's no air coming in and out of those alveoli because they're occupied by fluid or this consolidated material. So they still have blood flow, which puts perfusion greater than ventilation. And then the last one is pulmonary edema, which is kind of the same thing when you're talking about shunt versus dead space. When you think consolidation and you think consolidated material in an alveoli that's impairing air movement in and out. Same thing with pulmonary edema. You get this fluid leaking into the alveoli. The alveoli are now filled with fluid. And there's no air coming in and out of the alveoli. And that makes perfusion greater than ventilation because those alveoli are still being perfused. There's still blood flow passing through those alveoli. So that makes sense. Now when you think about this, when you think of atelectasis, you're thinking about any disease process that causes atelectasis. Post-op surgery, shallow breathing patients, pneumothorax, that causes air in the pleural space, which collapses all the alveolar tissue and causes a shunt. Pleural effusion compresses alveoli and causes a shunt. It causes atelectasis, and that would cause a shunt. Now, consolidation, you're talking about pneumonia and pulmonary edema, several things, but one of the big ones is CHF. Okay, so when we take this down to disease processes, you realize when we say consolidation, a lot of times we're talking pneumonia. When we talk about pulmonary edema, fluid leaking from the pulmonary capillaries into the alveoli, a big example of that is congestive heart failure with CHF, along with other things, okay? Now, what these look like from an illustration standpoint is, if we talk about atelectasis, you have alveoli that look like that. They are collapsed, right? But you have blood flow passing by those atelectatic regions. If the alveoli with pneumonia or pulmonary edema is filled with fluid, then you have alveoli that look like this. And you see blood flow passing through these consolidated or fluid-filled alveoli. And there's no gas exchange happening because perfusion is happening past an alveoli where there's no ventilation happening. And so that is what you get when you're talking about a shunt. Now, when we talk about dead space, we talk about ventilation greater than perfusion. So what does this look like, and what are we talking about? Well, we're talking about any disruption in blood flow through the pulmonary capillaries. So the big one here is pulmonary embolism. You can also have COPD. This is when we're talking about dead space problems. These are two of the more common dead space diseases. Now, when we give you graphical illustrations of this, what you'll see with pulmonary embolism is you have a normal alveoli, but when you look at blood flow, you see that you have a clot, and there's no blood flow passing by that alveoli. So you have ventilation of this alveoli, but the gas coming in and out of it is not participating with gas exchange. This creates a dead space problem. When you're talking about COPD, you're talking about a big hyperinflated alveoli, and you have blood flow coming past it, but you have to understand that the center of this hyperinflated, enlarged alveoli, this gas here does not participate with gas exchange, even though it's being ventilated. So this is why COPD can present and presents with a dead space problem. Okay, COPD is not a shunt problem. You have ventilation in excess of perfusion. Okay, now I'm going to erase all this because I'm going to bring this back to VQ ratio discussion, because that is the area. VQ ratio is the area that I sucked at when I was a student. I don't know if I ever got a question right related to VQ ratio. And my purpose here today is to tell you how to answer these questions correctly and open your mind to something here. Okay? I'm going to show you something that you're going to go, that makes perfect sense. So, if you understand shunt versus dead space, then you're on a good path to understanding VQ ratio. Okay, so I'm going to erase all of this. And now we're going to put a line up here that says VQ. And like I've said before, you have to understand that VQ ratio is a line of movement. Increase, decrease. It's not a one single number. But we have a starting point. That's what's important. So when you think about ventilation over perfusion, what we have here is we know normal minute ventilation. Let's just go with 5. We know it's 5 to 7, but let's just go with 5 because I'm going to make the math easy for you. When we talk about perfusion, we know cardiac output normal is 4 to 8 liters per minute, and I'm just going to go with 5. And that gives us a VQ ratio of 1. So 5 over 5 equals 1. Now what would cause this ratio to increase or decrease? That's the question. Now, remember, when you said shunt, you said perfusion in excess of ventilation. These are atelectatic regions, consolidated regions, fluid-filled alveolar regions. So that in those areas is going to decrease the ventilation. So we're just going to say 2.5. So your ventilation in those affected areas is 2.5. Your cardiac output is 5. This takes your VQ ratio to 0.5, which is a decreased VQ ratio. That makes sense, right? So if perfusion exceeds ventilation, when we do the math, we see that it decreases the VQ ratio. Now, the exact opposite is true also. If we start at 5/5, but we have an area where perfusion becomes blocked, okay? So, such as pulmonary embolism. If this decreases to 2.5, then 5 divided by 2.5 is 2. That's an increase in VQ ratio. Okay? Now, I told you COPD, right? Well, COPD doesn't cause a disruption in blood flow, so blood flow stays the same, but ventilation increases. Still, 10/5, do the math, equals 2. You still get an increase in your VQ ratio. So what we know here is that Deadspace causes an increase in VQ. Shunt causes a decrease in VQ. That's the key. Now, if you understand the diseases, if everything I've said so far makes sense, then you should easily be able to answer these questions I'm about to ask you. So, I'm going to erase all of this, and we're going to do some practice questions. Now, I'm going to start with the question I got in the email, which was probably from a practice TMC exam or something along those lines. And it basically said you have a patient who had a VQ scan, and the VQ scan in the right upper lobe showed decreased ventilation and normal perfusion. So I'm just going to stop there. This is in the right upper lobe. So they give you this information. Patient has a VQ scan. In the right upper lobe, it shows decreased ventilation, but normal perfusion. So, and the question was, what could be this patient's VQ ratio? Now, option A, 1.5. Option B, 1.2. Option C, 1.0. And option D was 0.8. Now, this is a point. 0.8. Now, if you understand VQ ratio and you understand that normal is 1, and you understand that a shunt is a decrease in VQ ratio, and that's perfusion greater than ventilation, and you understand that Deadspace is a ventilation in excess of perfusion, then this question becomes much simpler if you understand how those two things affect your VQ ratio, obviously, right? So, first of all, we know that normal VQ ratio is 1, so it's not C. Okay? If it was 1, then right upper lobe ventilation would be normal. Right upper lobe perfusion would be normal. But that's not what we have. We have a right upper lobe perfusion that exceeds right upper lobe ventilation. So if you go back to your numbers and you go 5/5, but now you say perfusion is normal, but it exceeds ventilation, and you change this to 4, and you do the math, you're going to get 0.8. Now, these are arbitrary numbers. The question didn't give you numbers. These are numbers that I put in. Okay? Just to show you how the VQ scale works. Remember, perfusion in excess of ventilation is a shunt. It causes your VQ ratio to go down. So if you know normal is 1, then it can't be 1. It's not 1.2 or 1.5 because that's an increase. It's got to be D, 0.8. Now, here's the thing about this question. Look at this, guys. If you know normal and you can eliminate normal right off the bat, then you have to choose between 3 answers. One of them is decreased. 2 of them are increased. Well, with the information you have, which is nothing more than right upper lobe shows decreased ventilation, right upper lobe shows normal perfusion, You don't have numbers to calculate anything by. Both of these are increased. This is decreased. This has to be the answer because this is the oddball. You have a normal option. It's not normal. How do you choose between these two? You can't. So it has to be the 0.8, and that was the correct answer. Okay? Let me give you another example. This is another example, kind of the same type of thing, related to VQ ratio. What effect would a PE, pulmonary embolism, have on your VQ ratio? A, B, C, D. A is none. B is increase. C is drastically decrease. And D is minimally decrease. Well, again, you ask yourself, okay, they threw the same question at me, but in a different way. But pulmonary embolism equals ventilation greater than perfusion. Every disease process is going to have an effect on your VQ ratio, so it's not none. So does it cause it to decrease or does it cause it to increase? The drastically and the minimally, they don't matter. They're distractors. The answer here is ventilation in excess of perfusion equals 2. Normal is 1. 2 is greater than 1. So it has to be increased. So your VQ ratio for a pulmonary embolism has got to increase. Okay? One more and then I'm going to let you guys go. Which of the following will cause an increase in your VQ ratio? And the answer here is A, pneumonia, B, atelectasis, C, COPD, D, pulmonary edema. Now, if you want to try this, pause this video, come back, I'm about to explain it, okay? Just like the other two. I forgot to tell you to pause the videos previously, but pause this video, see if you get the right answer. Now, the question here is which of the following will cause an increase in your VQ ratio? What causes my VQ ratio to go up? Ventilation in excess of perfusion. So, which of these disease processes leads to ventilation being in excess of perfusion? Well, it's not pneumonia because that leads to a decrease of ventilation of those areas and an increase in perfusion. So you have perfusion greater than ventilation. Atelectasis is the same thing. Perfusion in excess of ventilation. That's not it. COPD? I don't know. I don't really know. I don't know. What about pulmonary edema? Oh, wait. My alveoli are filled with fluid leaking from the pulmonary capillaries. So that would be a decrease in ventilation with an increase of perfusion. So that's not it. That would be a shunt. That would cause a decrease in the VQ ratio. So it can't be that. So the answer must be COPD. And that's the correct answer. Now I could easily have put pulmonary embolism here. I didn't because it would have been too easy. But it's simply and very easily and most likely on your TMC will be pulmonary embolism. So I'm just going to put PE right here. Now, another way you can answer this question if you have no idea what's going on is look at them and go, okay, pneumonia is consolidation. That's going to cause my lungs to become filled with fluid. Atelectasis, collapsed alveoli, you still have perfusion. So that's still there. Pulmonary edema, alveoli filled with fluid, still perfusion active but no ventilation or decreased ventilation. COPD or pulmonary embolism. This is the only one who presents with a situation where you might have ventilation in excess of perfusion. And that's the right answer. And a lot of times you can look at this. If you think of atelectasis, pneumonia, and pulmonary edema, if they're all shunts, if you go, well, I don't know, but I know this is a shunt, and I know this is a shunt, and I know this is a shunt, and I know pulmonary embolism COPD is dead space, then whatever they're asking you, it has to be this one. It has to be the oddball. Because the rest of these three would cause a decrease in your VQ ratio. Does that make sense? I hope so. If it doesn't, put a question up and I'll address it. I'll answer your question and I'll try to simplify it even further for you. I hope this video makes sense. Hope all you guys are enjoying your final semester, your second semester, your second whatever semester you're in. If you're in a bachelor's program and you're in your whatever, fourth semester, whatever it might be, I hope you're having fun. I hope you're having a lot of fun, and I hope you're learning. Send me your questions. Send me your requests. Hit the subscribe button. And turn on all your notifications so that you know when this video goes live, you know Respiratory Coach put out another video. Appreciate you guys for watching. Best wishes.